Hi guys, welcome back to the channel. This video today we are going to be discussing what can you do after FMG. This is not necessarily after passing your FMG exam, but this is also if you have just given the FMG exam and it takes about a month to get the results, and if you pass then it takes about 2 more months to get your passing certificate and do all the formalities to get into internship or whatever you want to pursue after that. So if you have that time in your hand, how can you utilize that time? How I utilized my time in those days, and what you can do to get into a private setting. If you want to work in Delhi, I worked in Max Super Speciality Hospital for some time, and I also worked in another private setup for about a year. So I can give you a brief what would be your job responsibilities and work responsibilities as a new doctor joining in a certain department. So let's get started with that. What you can do after FMGs in the first month is, suppose if you haven't registered, if you didn't get registered yet because you haven't passed your FMG and you have that period of time with you, then what you can do is you can go for observership. Like you go for observership, like you must have heard about the USMLE thing. People go for observerships. Same way you can do it in India as well. Many small setups, small private setups would allow you to do observership. You can go and talk to the HR department, their HR department. You can even directly go and talk to some of the consultants. They might also help you. I was back in Saharanpur, and there was a new hospital, I think, which was big and new, where I asked to join in, and they said okay, you can come for 2-3 months as an observer. The only one thing they asked me to do is be disciplined for timings. It would not be like internship. Many people think that you can come and go whenever you want. All they wanted was to follow a routine, for me to set a particular time that I'll be available from 8 to 2, suppose, and then be available in that slot of time, so their working does not get affected. So that is the first thing you can do. You can go to some private setup, even a small setup, small or big, doesn't matter. You can go there and ask for observership. Okay, so this gives you a lot of confidence. If you are suppose living in a small town, then it really gives you a lot of confidence if you have worked in or seen how the work is done in a private setup for 1 to 2 months. Then if you come to Delhi and suppose apply for something or apply for a job in a private corporate sector, then it would be easier for you to get a job here. And your confidence level, basically they test your confidence level more than your knowledge level, because as you are a fresher, everybody knows you are a fresher, so you would not be intubating a patient or doing big things. But they want to know, mostly they prefer people who are confident enough in their skills, whatever they know. And obviously a little bit of theory, little bit of practical in hand knowledge is also very important in order to get a job or crack a job. I went for observership kind of thing, but then I moved to Delhi because my parents moved to Delhi in very short time. So I went to get an observership. I got it, but I never attended it. I never got a chance to actually go there for even a day. So I could have done it, but I couldn't do because we have to move. But if you can do it, then it will be really good for you. It will give you a lot of confidence, as I said. That is the first thing. Okay, the second thing what you can do when you come to Delhi or a big city or a metropolitan city, where obviously people move to big cities as a doctor to get good exposure, to get good salaries, good amount of salaries are there, good amount of jobs are here. In Delhi right now it's a little bit difficult. Delhi NCR has a rush of suddenly many doctors from many places, because all over India places people come here, but still you'll find job. You would have to hustle a bit. You will have to wait for a bit. If you want to go for the government jobs, it would I'm not gonna lie, it's gonna be difficult because there are a lot of people, but you can get a private setup job easily. So that would be good enough, and they have like good exposure. If it's a corporate hospital, good hospital like like Max or Fortis or Apollo or Medanta, whatever, then you can get a good exposure out of it. All right. So second thing, what you want to do is go to the HR department and ask for interviews, obviously, and ask for if they have any available seats. I'm only talking about private setup because I didn't work in a government setup here. I only worked in a government setup in Saharanpur, which was District Hospital Saharanpur. And after that I moved to Delhi. I worked in Max Hospital, Max Super Speciality Hospital, and then I worked in another private setup which is not as big as Max Super Speciality, obviously, but that is a different story why I moved there, that we will discuss another time. So second thing you have to do is find vacancies. You have to search for an area where you will be living in, or where you are comfortable in, and go and ask for if they have any openings, or if they have some places left for you, or in coming future they're gonna have a vacant place for you or not, and if they are taking freshers. Actually, when I was here, Vaishali, I came here, then they were taking freshers after interview, but a year later I got to know that they are not taking freshers. Max Super Speciality hospitals were not taking freshers, and they were asking for minimum 2 years of experience for them to join in. So that you have to also ask them if they are still taking freshers or not. If they are not taking freshers, don't panic. There are still a lot of hospitals which require MBBS doctors. You can try in those. You have to talk to their receptionist. What would be easier is call the receptionist and then ask. Receptionists usually know if they have a vacancy or not. If they do, then go personally there and ask for an interview, or talk to the HR department, or ask about the details, what you can do about that. Okay. Now third thing I want to do is, if you get an interview, suppose you have an interview, right? What are the things you need to know to get into an interview? Since I gave my first ever interview in Max, and Max is a proper standard procedure, like they have a proper standard thing, so you can take it from me. Like, what questions they'll ask, basically what questions they'll ask you, basically they'll test your confidence. So don't feel like you don't know anything. If you know also everything, and if you're not confident enough in answering in your body language, that is not going to be very beneficial for you. So I would urge you to please maintain a decent level of confidence in yourself, so the other person can have faith in you as well, even if you do not answer all the questions. What questions they'll ask you is, they'll always mostly ask you emergency medicine questions. So you need to know how to handle the emergencies, okay? How to handle any emergency, and what initial steps as a junior doctor you have to do if you see a patient. You should be able to diagnose or tell what system investigation that person needs. Suppose you have to observe and reply. They'll give you a case scenario, basically. A patient came with so and so thing, and his vitals were so and so. So out of that, you should be able to tell him or her, whoever is interviewing you, the first step, what you'll do next, which system is getting affected most, what you should do next. Sometimes they'll ask you the malaria ka case. Sometimes they'll ask you a respiratory distress, asthmatic attacks ka case, okay? Sometimes they'll ask you bleeding disorder ka case. Sometimes they'll ask you CVS ka case, cardiovascular ka kuch case hoga. Trauma, they ask you a lot of trauma questions. Even in exam, there are a lot of trauma questions. They ask you a lot of trauma related question, that if the person is so and so, happens so and so, then what you'll do, and things like that. Your basics should be good enough. How will your basics be good enough? What will it? Same thing, emergency medicine ka all the topics you need to brush up once. Ki what injections you'll give in immediate effect, or what fluid you'll start immediately, what investigations you'll do first hand if there is no one available and it's just you and the nursing staff available, and if there is no senior consultant available. So you should be able to answer those questions. Another thing, you should be good enough in your basics. What are the normal values? Okay, so just know the normal values. Know the normal values of various parameters, like normal BP, normal sugar level, normal sodium potassium electrolyte level, right? Normal sinus rhythm ECG, you should be able to read a sinus rhythm ECG if it's sinus rhythm or not. ST elevation thoda bahut changes, you should be able to pick those up. If you know this much, then it would be good. Another thing you should be able to know is ATLS guidelines and ATLS procedures. If you know this is an extra edge. If you know this, you would have a good impression. They would be really happy with you. Since this is my personal experience, I knew it. I knew things like these are important in emergency situations. So they asked me a few questions regarding this, and I was able to answer them, and that is why I think I cleared the interview, because there were a lot of people. I think Indian graduates were also there, but many of them were not aware of proper protocol. That's why maybe they didn't clear it. That's what I think. I don't really know, but knowing ATLS is very important. So you have to know that. And yeah, I think that much is enough to crack any interview and get into a private setup. They negotiate the salaries in smaller setups. Like, they ask you what do you expect out of them, and you have to give your range, and they give their range if they can go afford you or not. So that you have to know, and that depends on locality, that depends on area to area and setup to setup. So just have a broader idea. Mostly corporate hospitals, they don't give you a range, they offer you a fixed thing, and that is for everyone. So in corporate hospitals, you don't have to worry much, but for individual private setups, smaller setups, you need to be aware about how much the neighboring hospitals are paying, and so on and so forth. So these are a few points I want you to know. I will be making more such videos if you really require them. I think new people who come back from abroad, who have done their MBBS abroad and they pass their FMGs, they are good in theory, good in practicals as well, but somehow they feel left out, because they feel like we don't know what is going on in India, what is the process in India, and they hesitate sometimes. Even I was scared in the beginning ki pata nahi kaise hoga yaar, how I'll do, what they'll ask. So it's fine, it's normal. Just follow these basic steps and you'll do great. Thank you so much for watching. Let's make more such videos, and if you like it, please let me know in the comments, and if you want to know something else as well, please let me know as well. And today is the 1st of January of 2025, so wish you a very happy new year, all of you. For everyone who is giving the 2025 12th Jan FMG, I wish you all the best. Please keep studying. I have made a very good playlist on my YouTube channel and a video regarding it. If you are someone who is not well prepared and you lack something in some subjects, I think you should go and watch my recent videos, and there is a playlist given there. Watch those 5-6 videos before you give your exam, and I'm sure that it will boost your confidence and your performance as well. So thank you so much, guys. Thank you.